Well, thank you all. Thank you all for being here and for your attention for a few minutes. I'm going to beg your forgiveness to be a little overdramatic here in the interest of holding your attention. I'm going to point out to you that telepsychiatry is one piece of a rather large intervention that we have piloted with the help of the Delivery Services Transformation team. So my thanks to Dean Whitley from the IHN CCO and many others from the state, including Bill Bushka, Kevin for leading the way and helping me with a grant so we could explore some of these ways. The bottom line is, how do you take too few psychiatrists and spread them around better? How do you take too few psychiatrists and spread them around better? So I won't need any of that, thanks.
No microphone?
I won't even need
Not even
that.
for the video?
Yeah, we need.
Did I like wander out of the frame
You
here?
did. As long as you have the mic, you can go anywhere you want.
And I've been roped back in, thank you very much. So how do you take too few psychiatrists and spread them around better? We are very well aware, a national dearth of psychiatrists and psychiatric nurse practitioners, people who can do the work for a growing number of people who are presenting with mental health problems. Whether that's an actual increase in mental health problems or actually just more people willing to come forward with them because stigma is going down is an interesting and longer discussion. Suffice to say, there's a ton of people out there who are looking for help and way too few people to provide that help. So for the purposes of tonight's demonstration only, we will say that y'all are our specialty mental health providers. Psychiatrists, psychiatric nurse practitioners, and the rest of your table is psychologists, social workers, psychotherapists. You are specialty mental health providers. Other specialty mental health providers can be found in county mental health programs, and so we have Cheryl O'Connell and her whole team there at the table to represent Lincoln County mental health. And then over here, we have all of our counties of people looking for mental health care, not these people looking like that. But the rest of our community, many of people who do not look like this, and they are going to try to get help from this group of people over here, and they're just running into the problem of access. There aren't enough of those people. They're working extremely hard. There's very little room for criticism of anything that they're doing. There just aren't enough of them doing it. So how are we going to solve that problem when nationally we can't go out and create magically a whole bunch of new providers? That was the challenge that we took on with our grant. The answer turns out to be that before these people get to those people, they actually come through this other station called the medical home, primary care. And primary care, it turns out, has been delivering more than half of all mental health care in the United States for over a decade. This is where most mental health care is taking place, not over there in specialty care. For depression, this is twice as much as that. So if there is a way to go out and make mental health care writ large more efficient, we decided that perhaps it's by bringing our psychiatrists to help the primary care team deliver more effective mental health services right there in the medical home. That also has the advantage of, these people, many of them still understandably for stigma and many other reasons, don't want to go over to see those specialty providers, but they're very comfortable coming here to their medical home. So if we can bring better mental health services here, we thought that might be the most efficient way to answer this question of how do you take too few psychiatrists and spread them around better, spread their efforts around better. So what we've done here, we're working in all 3 counties simultaneously, and in many respects we've made the greatest progress in Lincoln County, glad to say, because of the work of the IHN CCO and my department chair, Caroline Fisher, really taking some big leaps forward in the way care is being delivered. We're following a model that was developed in the University of Washington for the entire state of Washington called collaborative care, in which a psychiatrist like me, and there are several others among us who are doing this, particularly in child psychiatry, where if anything the problem is even worse. We psychiatrists are remotely available to our primary care colleagues. They're still doing everything they were doing, but we can, because we are now, through being a member of the Samaritan team and a member of their clinic team, whether we're in the clinic or not, we're in the same medical record, so I can use their charting to work from Corvallis and say, for this chart, this patient on whom you've asked some help, based on what I can see, you might think about trying to do this. Why don't we try that next and see how that goes? That doesn't work so well if it's just me remote. We learned that early on in our grant. What we've done is add the next ingredient from the University of Washington, which is an in-house mental health specialist who is a psychiatric liaison. It's my personal working colleague and representative in the primary care medical home. Her or his job is simply to make my work more effective by gathering the same data that I would usually use. So we taught them over a month worth of training. We taught a whole bunch of these mental health specialists to work in primary care, to gather the data that I usually would and put that in our medical record so that I over in Corvallis can then have a more rich database, a better understanding of who it is we're trying to help, but I'm still doing it remotely. Does that make sense so far? Now mind you, also in the primary care clinic, we also have people who can actually deliver psychology, a psychotherapy approach, whereas we psychiatrists might be more given to a psychiatric approach, which includes big picture stuff and medications. But how about delivering psychotherapy services right in the clinic? In a whole separate program, Dr. Mark Taylor here is one of them, and I don't think I have any others here this evening. Dr. Taylor is right here in Samaritan Pacific Internal Medicine. He is a psychologist with many years experience. He's doing in-house psychotherapy services. So he is working there, and then we bring in our mental health specialist who's going to work alongside him. They're not to the Newport clinic yet, they're up in Lincoln City so far in Toledo. So they work alongside Dr. Taylor, gathering information for me. I'm working with his information, with my mental health specialist's information, so that over in Corvallis, I'm making treatment recommendations. Now, much of the time I can do this without directly seeing the patient because the next step will look relatively obvious to me. But, getting up on the order of half the time, it would really be better if I could see the patient. So now we're going to bring in the telepsychiatry angle. What if this is just so simple, it's no really big deal. What if we had a set of television screens here in this clinic, and we can beam me from Corvallis over here into the clinic, and the patient from there to me in Corvallis, so I can have a telepsychiatric interview with the patient here in their medical home. So we've got that going in Lincoln City so far. Our plan is to extend it to the rest of the clinics here on the coast, and we're actually working more slowly to get it spread out into the other counties as well. So again, I hope you see telepsychiatry is just a little piece of this. It's really a whole program designed to answer that question of how do you take too few psychiatrists and spread them around better. It's our effort at Samaritan to improve that access to mental health specialty care without making people come over here and then have to go through all the processes that it takes to try to get in, including traveling all the way to Corvallis sometimes for that. Hope that makes sense.